night as chair.
Okay. Sam, would you like to close the door? Yes. Or Bob? It's got a hook on it. Okay. So welcome everybody to the Health and Wellbeing Board for Bournemouth, Christchurch and Poole. Bob, can I turn to you for any housekeeping issues, please?
Thank you, Chairman. Good morning, everyone. There's no fire drills planned, so if we do have an alert, I'll lead you all down to the main entrance and out to the front. Normal recommendations about mobile phones, etc. And I realise there's a lot of people here. Don't know everyone by any means. So there is a sign-in list which I'll circulate. So if you could sign it, and if you're not on the list, if you kind of put your name on the bottom as well. Thank you, Chairman.
Thank you, Bob. Do we have any apologies for absence that we've been notified of?
Chairman, apologies from Tim Goodson from the CCG, and apologies from Graham Farrant, Chief Executive BCP. Apologies from Iafeli, so I don't know his name. And I think we have Colin Hicks substituting for him. Yes. Yep. And apologies from Jay Vaughan from the Dorset Police and Julie Fielding substituting. I think that's all the apologies I've got, unless anyone else has got any others.
Okay, thank you, Bob. Do we have any declarations of interest? No? Okay, so then we move on to item 4, the confirmation of minutes and action sheet. So what the minutes of the meeting held on the 25th of September 2019. Do we have any comments, any corrections that need to be made to those? I've already signed them off, so we'll sign them off as a correct record of the meeting. Hi, Judith. And the action sheet. Bear with me. Paperless is not always quicker when you have to try and move between about 3 different systems. So the action sheet. We have the amendment. Where are we? Yeah, so amendments to the protocol. It's been confirmed. Name substitute can be provided. That's complete. The approval of the Better Care Fund has been included in the forward plan. The send update. We've asked the Transformation Board to bring back proposals on the governance expectations. I'm not quite sure when that's due to be happening, but Judith has only just come in the room, so we might just come back to that. Quarterly update, thank you very much, so that's okay. And the transformation, yes, I can see that the action from that slipped onto the next page. Right, that one's from the previous actions from the board meeting 25th September. Better Care Plan 4 plan, yes, that's on there as well. And the only other one was the pharmacy, where Sam has agreed that he'll update us as and when there is anything relevant to add. I think that's what was agreed.
Sorry, Chair. We did respond to the detailed questions. It's gone back to Democratic Services, so we can either include that as a note with the minutes from this meeting, or I can respond to the questions now.
I think I'm quite content that it's a note added, unless anyone else feels the need to have those answers now. No, if that's okay, Sam, if you could just add that on, let Democratic Services have that be useful. Thank you very much. Okay, so that moves us on to item 5, which is public issues. I don't believe we have any questions, statements or petitions that have been submitted by the deadlines.
Correct, Chairman.
Thank you. And that brings us on to item 6, BCP Council Local Plan, which I believe Nick Perrins will be presenting. So this is just to give us an update on where we are with the local plan development. So can I hand over to you, Nick, and then we'll deal with any questions and comments afterwards. Thank you.
Thank you. Yeah, great. Okay, thank you and good morning, everybody. My name is Nick Perrins. I'm the Head of Planning at BCP Council. I prepared a report for your pack, which you've got. I'll just run through some of the key points in this presentation, which follows. So just a bit of background. As you know, BCP Council was formed back in April 2019. And as part of the setup legislation, there was a requirement to produce a new local plan for BCP by 2024. That also applies to Dorset Council as well. So both of the new authorities have this statutory requirement. And for BCP, we've inherited 3 legacy local plans and hundreds of policies. There's quite a bit of work to be done in terms of bringing that all together. And the current plans are a little bit different in terms of their strategy and direction of travel. So that's the context in terms of background of where we are today. So in view of that 2024 requirement, BCP Council back in September 2019 adopted the BCP Local Development Scheme, which is a statutory requirement to set out the milestones and timetable for a local plan. And as you can see, hopefully you can see here, the key message in this is that BCP Council want to adopt a local plan by 2022, by the end of 2022, which is that green block at the end of that timetable. So it's an ambitious timescale. It's seen as really important to get a new local plan in place for the whole area, which covers all our issues and strategic planning issues. So there's a real commitment to fast track that and get it done as soon as possible. And within that, there's quite a lot of work to be done in terms of evidence gathering, public consultation, and ultimately an examination in public on the draft plan. So just to pick out some of the key milestones, we already did our first consultation at the back end of last year, just setting out or asking our communities what sort of issues they think the plan should address. We're now working up to a consultation towards the end of this year, which is going to be really important. It's going to be setting out further issues and suggested options for addressing those issues. So just as a sort of highlight at this point in terms of this board and the work which this board does, it's a really important time to feed into that preparation for the consultation towards the end of this year. And then we move into 2021, and towards the end of that we plan to publish the draft local plan for further consultation. After that we're into the examination, which takes about a year, which will get us to 2022. So lots to be done. Ambitious timescale, but really positive in terms of moving forward the BCP local plan. The Dorset local plan is on a similar timescale as well, so hopefully we're going to sync those two up in terms of cross-boundary issues. The corporate strategy then followed in November 19, was adopted, really important document for BCP Council. It sets the vision, sets the key themes. You've probably seen that already and considered that, but that's going to underpin how the local plan will shape in terms of how the planning side of the council can help deliver the corporate plan or corporate strategy. Just to touch on some of the key issues which you may be interested in terms of health and wellbeing and links to planning. We have a significant housing need across BCP. There's up around over 2,500 homes a year, which is astonishing really. It's a real challenge. We currently deliver around about 1,800 a year. So there's a huge jump in terms of how this council can accommodate that level of growth. It may not be possible, but in planning we have to make every effort to try and do that. We have a lack of affordable housing across the area, so we need to do something around boosting the supply of affordable housing, jobs and wages. We need to essentially replace an ageing workforce. We need to try and boost economic activity generally. There's the ageing population. We need to obviously provide accommodation for our ageing population, which is a significant issue in itself in terms of our housing needs. There's the issues around obesity and inactivity. This is a national statistic, I believe, but there's around about 30,000 deaths a year, which could be avoided by just having increased activity. So there's a sort of planning element to that in terms of how we can promote increased activity for our communities. Social exclusion, access to services, how do we connect our communities better through the planning system? We have the real issue of congestion across the conurbation, how do we address that? And the issues around air quality and highway safety, and lack of green space. We're a pretty tight urban area. We do have green space, but it's not distributed as equally as it could be. And there are some issues in more deprived areas around access to green space. So these are sort of issues which we'll need to start considering, hopefully collectively going forward. Just in terms of what the planning system can do, done well. So in terms of neighbourhood design, we can we can deliver new neighbourhoods which promote connectivity and increased walking and better design and vibrancy. This all helps with how a community looks and feels in terms of its health and well-being. Housing, we need to provide quality housing. We need to improve energy efficiency and how and basically how people live. So quality housing is a really important aspect, and I've already mentioned affordable housing, really important for the health and well-being of a community to be able to afford to live in the conurbation. Healthy food, there's an increased requirement on the planning system to consider how it can respond to food going forward. So there are things like safeguarding allotments, and we haven't got that much, I don't think, across BCP, but where it does exist, there's a requirement to protect food production. The natural and sustainable environment, we've mentioned this, I already mentioned this in part around the importance of green space and a quality environment, trees and things like that in terms of responding to the climate agenda. So safeguarding the environment across BCP is going to be a real strong push on that, but we need to balance that against the quite astonishing housing needs we have. And of course transport, so we want to promote sustainable transport, we want to have walkable neighbourhoods, which I've already mentioned. We want to promote cycling, walking, other forms of sustainable transport, and how we do that in the conurbation is going to be fundamental. So these are all the sort of things which we're looking at in the local plan. In terms of work to date with some of you around the table already, we've done a lot of work in the past on infrastructure planning, and we've got some good examples of where we've embedded health and wellbeing issues into plans already. Pool Local Plan, which was adopted November of 2018, is generally recognised as quite good practice in terms of its approach to health and wellbeing, so we can build on that. We've had some success with developer contributions in the past in terms of securing money towards enhancing doctor surgeries locally. We probably have to develop that a bit further, but we have secured some money already in some locations across BCP. And we also set up a task and finish group back end of last year between NHS Trust, CCG, Public Health Dorset and ourselves, the local planning authorities across Dorset, to start looking at this issue a bit more widely about how the planning system might be able to support or not development and tariffs on development to support health-related infrastructure. So that's a sort of snapshot of what we've done to date. But going forward, basically it's just to set out the local plan. We're at the start of the process. There's really good opportunity here to engage with yourselves and work out how we're going to work together. From the local planning authority point of view, we really want to work closely with you. We could share the evidence base. We could form that together in terms of what are the key health and wellbeing issues which the local plan should address. We'd also like to ask yourselves, what do you think are the key issues for health and wellbeing which the local plan can reasonably address? So that's the sort of invitation to you to tell me, and we can then consider that going forward, and also how we work together. We've got the task and finish group set up, although at the moment it's all focused on developer contributions. There could be an opportunity to expand that scope going forward, and having that as a bit of an ongoing liaison sort of operational group to help form the local plan going forward. And I understand you're also considering having your own workshops with members going forward, so maybe that's an opportunity for local plan issues to sink in with that if that's appropriate. So it's basically an invitation from us to you to set out how you would like us to work together, and if there's any specific issues you think the planning system should address, where we're not doing it well at the moment and what could be improved in the future. So that's essentially a bit of a whistle-stop tour of my report and my presentation, so over to you for any questions, which I'm more than happy to answer.
Thank you, Nick. Before we take questions, could you just flip back to the corporate strategy wheel? Thank you. I just wanted to confirm, I know some people in the room have seen this, but there will be some people who might not be completely aware of how this fits in. So if I just very briefly just talk to that wheel, in that the corporate strategy that was adopted allows us to put down on paper our direction of travel, and our sort of key drivers around creating vibrant communities where everybody has a role to play, and the 5 sort of key areas around the edge of sustainable environment, fulfilled lives, brighter futures. connected communities and fulfilled lives. So everything that we do going forward, and everything that we reach out to our partners and talk to them about will be around how does it help us to create those vibrant communities and one or more of the elements of that wheel. So I think as we move forward with our local plan, everything that we do is going to be checking back in and going, how does this influence? Are we on the right lines? Are we checking it off against our sustainability, well-being and investment? And if it isn't, actually it's going against the grain, and therefore there's got to be a really strong justification for why we might do it. But I just think it's worth referencing that back so that people understand why that's the driver. And also to let you know that in 2 weeks' time at Cabinet, we'll be taking forward the next stage of this, which is the delivery plans around this strategy. So in each area, you'll see there's a list down the right-hand side of the key elements of each of those 5 factors. And we've added a 6th, which is a modern, accessible and accountable council. And for each of those bullet points, there is a series of actions that will follow and a series of key measures of success. So we'll be setting key performance indicators for each of those so we can make sure that we are all on that same journey together. So you'll see that come out with the Cabinet papers, and I'd encourage you to have a look and see where that dovetails in with other organisations, because I think that's probably going to be very relevant to other partners. So thank you for that, Nick. I've got a series of questions, but I'm going to go first of all to Karen.
Hello Nick, Karen Loftus from Community Action Network. We're an umbrella infrastructure organisation, and we empower the voluntary sector, enable volunteering and involve communities. I guess it's more of a comment and an offer of help and support in terms of linking with the voluntary sector and the community sector to help inform the plan going forward. So my offer is, if you need any support, want to reach out, sort of help to inform the plan, we're here to help. I'm here to help personally, and so is my organisation.
Thanks, Karen. Sam?
Thank you, Chair. Gets me every time. Can you hear me better now? So my question was a pragmatic one, because you mentioned in the paper the role of health impact assessments, and in some instances they can go on for quite a long time. They can be quite technical. So it's really to give some thought as to how we can perhaps assess some of the opportunities in a more rapid way, and whether that would be through the Task and Finish group going forwards. And I think that Task and Finish group, I'm really heartened that it seems to be thinking already beyond the impacts on health infrastructure. Actually, if we do this in the broadest possible sense, can we identify those real priorities where we can make the greatest difference, and perhaps have a focus on those first? So it's not really for answering now, but if we could kind of think about how we could do that in a more rapid sense, that would be great.
Leslie?
Yes, thank you, Chairman. I was going to talk about health impact assessments as well, but in a slightly different vein, only in terms of wording on item 12. Seeking to restrict the location of hot food takeaways. I find that not the thing that we should be doing. It's only a question of wording. What we should be saying is encouraging the promoting salad bars. It simply is that I do not approve of restricting in that sense. I approve of encouraging, which I'm sure Sam has in mind for his own portfolio. Thank you, Chairman.
Thank you, Leslie. So what you'd like to see is that we should consider seeking to encourage juice bars and salad bars rather than takeaways near schools and things. So it's about encouraging rather than banning.
Yes, absolutely.
Yes, no nanny state.
I didn't say
Does anybody else want to ask? Debbie?
I've not used it. This is my first time, so I can't be guilty of anything. Just want to, really a question from me to understand a bit better. In terms of the way by which we're having these conversations, how is that happening? So I note in the paper there's the discussion about the task and finish group, but that, just reading that, it sounds as though that's a lot about looking at a tariff, and actually what's more important is making sure that we're joining up and really identifying the priorities coming from our shared conversations. So I just wondered if how are we having those discussions?
I think that's a really fair point, because I'd actually written down what is the role of the Health and Wellbeing Board in a formal submission through this, so that we actually look at where our priorities are. And I suppose that's the question, is the task and finish group was set up to look at specifically developer contributions, and I'm also conscious that in the summer the Cabinet will be looking at the community infrastructure levy and that's it, well done. The community infrastructure levy and what we should be focusing our attention on. So obviously as a Cabinet, you know, we have an input in setting that SIL structure. So Nick, I'd be interested to see how the two work together, but also whether it's more valuable for the Health and Wellbeing Board to have a formal submission into this, or whether it's actually more helpful for the individual partners to be thinking about their own submission, because you know, by its very nature, you end up with we all have to have the same view if it becomes the Health and Wellbeing Board's view, and we might not have the same perspective. So what's your view and how it's been done in the past?
Yeah, so in the past, by and large, it's been individual responses from the individual organisations, which I would still encourage, actually, because you're absolutely right. There may be different views. So I think we should still encourage that, absolutely. But I also think the Health and Wellbeing Board may have some shared principles, which you collectively would want to all buy into and inform the local plan. So I'd definitely encourage that as well. So there's a bit of both, really. If you've got a specific issue, please individually tell us. In terms of the vehicle for how we engage, the task and finish group, it is developer contributions focused at the moment, and it may not be the appropriate thing to do to expand its scope. So the question would be then, how else would we work together going forward? And it may well be through workshops or other means. It doesn't have to be the task and finish group. We could leave that to carry on with what it's doing, and that will absolutely feed into the wider debate around community infrastructure levy and Section 106. They'd be part of that process to form that BCP Council work going forward. So there's a question there about, is it the right vehicle? Maybe not. If it's not, then something else would need to take its place, in effect.
Thanks, Nick. Jan, you wanted to come in?
Yes, I agree with Nick. I think it's really important that individual organisations have the opportunity to really get engaged and feed in, and also networks of organisations do too. So I think that's really important. But I also agree that I think we collectively, as a board, should have an input. And I just wanted to say that I thought your slide, and we might want to bring it up, Nick, your slide on some of the things that may resonate with this board, and maybe that slide, that one, I think in terms of the issues that influence health and well-being, I think is probably our joint accountability. So one of the proposals is that this board would have a more in-depth development session on this plan in the spring, which I think would be very welcome. I think to also think about, and I also want to acknowledge around the table that actually the representation of this table is beyond the council and health, and just really acknowledge that. So I suppose what might be interesting, Nick, is in terms of the development plan overall, what kind of workshops across sectors are you planning, or does this mean we need workshops? Seem quite a good idea where people can get the right people to that in their organisations, as well as us having a development session. But I completely think that the issues that you've raised there, and probably some others, and it may be just worth concentrating on that slide and just today saying round the table from any partner, is there any issue there that people feel isn't cited, I might say, for instance, on a health and social care perspective, there are the needs of working age people with complex needs, and indeed young people moving into adulthood, that resonates with the housing strategy. But also we just need to make sure that we have thought about disability and access in the wider sense. So that would be my thoughts, but I think the idea of workshops sound a good idea. But across partnerships, because I'm conscious of the Community Safety Partnership too, would want to have an input.
I think that's a fair point, because I'm thinking particularly of the police and the fire service. You know, there's a lot around well-being. Actually, if you look at the health and well-being, creating neighbourhoods which don't have unsafe alleys, or where people can move about in a very open way, and where we can keep an eye on vulnerable people so that they don't set fire to themselves. You know, all of those things are very much along both of your lines, which we don't really talk about enough, and actually we should be focusing as much on the well-being end as the health end, and I'm really conscious that we make sure we keep doing that. I don't know whether that's... Julie, do you want to come in and I'll go to Sally?
Thank you. Yes, so that was exactly what was on my mind, really, was around well-being and safety and community safety. So there's designing out crime, which are the sort of things you've described there, Chair, but also designing out harm. So what does it need to look like? And we've got quite a good evidence base now building around where are most vulnerable communities, and there will be an opportunity to look at what the features of those are and how we then design them out going forward. So I really welcome workshops, and then obviously the contribution from the board as well. So I'll be up for that. Thank you.
Sally.
Thank you, Chair. I was making the link really with what you've presented here, Nick, and the development session that we had, and the outcomes that we've had presented from those, and thinking about breadth and depth. So in terms of the priorities that we came out with from the development session, mapping those in terms of the breadth linked to the slide here, because that would pick up Jan's point around young people and other population groups. But then in terms of the depth and the connections with developing the plan and our prioritised work, we really talked about how we want to focus on those most deprived communities and initiate partnership working around that. So for me, there's a clear connection around how we then apply that and connect that into the wider local plan development.
Thanks, Sally. I think that's really relevant. You know, I wrote down about our year one focus, and actually how that links into creating spaces which allow people to live a healthier life, and obviously that then has a knock-on effect. So I think we've got that in the diary for a development session. Is everyone comfortable that that's a really good use of a development session? It's not the next one, it's the one after that. So I would encourage everybody to get that into their diary and think about how we can have a really positive input. I mean, you talked about congestion and air pollution. I was at City Hall on Monday presenting with the Deputy Mayor of London and the Mayor of Bristol, which was a slightly like, oh gosh, just Bournemouth, about the air pollution issues. And it turns out that the vast majority of our air pollution here is not from transport, and yet all of our focus is around congestion. 65% of the pollution, the particulate pollution that we have here, is coming from domestic solid fuel. Who knew? Who knew that this area is a spike? For, Tesco's data says that there's a particularly high level of solid fuel use down here. Everyone with their fancy wood-burning stoves is putting particulates into the air. So whilst we're working really, really hard to get out of our cars and onto our bikes, we're then potentially got another risk of people who are then breathing in the particulates. So, you know, it's all about, the other thing we were talking about was designing in bigger front gardens, so that when you open your windows, you're actually further away from the roads, and you're actually further away from the pollution, and having more windows at the back of your house so that you're actually exposed to cleaner air. It was absolutely fascinating, those small things which we don't think of, because all we're thinking about is, you know, the exhaust pipes from cars, and it's not even that. Wider pavements, that helps too, and walk on the inside, not the outside of the pavement. There you go. Bit of a hint for today. Sam, public health all over this.
Yeah, I'm not going to take up too much time because it's a really complex issue, but you raise a really, really important point, and actually the evidence around indoor air quality, particularly in houses that have wood-burning stoves, with the modern insulation standards, are an area where public health is now becoming increasingly concerned. It doesn't get a lot of airtime, but you're absolutely right. We need to get under the issue and understand, because otherwise we could be completely focusing on perhaps the wrong cause and not have effective interventions to deal with it. So.
That's not to say that we shouldn't continue to get people out of their cars, but it's the unintended consequences of doing both of those things and recognising in planning terms how we need to create that extra space. Kate?
Oh, here we go. Thanks. Just as a follow-up on air quality, I think just to clarify, that was around domestic and industrial burning, so we need to interrogate that a bit further, just before everybody thinks it's all about personal log burners. But I think it was a surprise, and I think one of the things that we've been reflecting this week is that we want to bring forwards the air quality strategy for the new council, which will require a lot of cross-cutting work with colleagues, and I think that would be something that probably you'd welcome coming here as well. So I think that's how we can kind of take that piece of work forwards.
May have been a surprise to you, but imagine the surprise I had when I'd written my report all about the great things we're doing with transforming cities. I received the embargoed report on Saturday and then had the weekend with no officers available to rewrite a report that was about something completely different, and then realised I was on a platform with some very important people. So I was more surprised than everybody, but you know, I think we held our own. So, okay, thank you. Does anyone else want to make any comment on that, or are we going to take that forward with a workshop in the spring, and hopefully Nick can bring some people down to really take the evidence back from that as well? I think that'd be really useful. Okay, so thank you for that. We'll move on to the next item, agenda item 8, which is the Dementia Services Review Update. This is an update to note. So is it Diane that's going to present on this? Yes.
Hello, Chair. Shall I introduce Di?
Yeah, thank you, Sally.
So,
if you could introduce it, and then we'll pass on to Di.
So yeah, really pleased to provide you with an update around the Dementia Services Review. We have given Di a bit of a steer to make it quite short and sharp, because the Health and Wellbeing Board and other partnership meetings have had quite a few updates around the Dementia Services Review. So we're mindful of that, and you've had the paper. But we're making some good progress here, which we're pleased to share with you.
Thank you for inviting me today, and pleased to give you a very brief update. So you all have in your packs a short report which sets out what I'm talking about and gives you a bit more detail. So the review began in earnest in 2017 with a view-seeking exercise and a needs analysis, which was really interesting. Just like to say that our whole process has been very much underpinned by co-production, so we've been working with a whole range of different partners all the way through the whole process. So what back in 2017 it told us was a whole range of things which probably isn't any surprises to anyone. Obviously we've got an ageing population, there was different access to services, a lot of fragmentation, long time to actually receive a diagnosis. And I think the particular issue that people were most concerned about was the lack of post-diagnostic support for people living with dementia and their families, and also the lack of specific services for people with young onset. So then during 2018, we went forward with a design and modelling stage, again through co-production. Then that was followed by NHS England's assurance processes. So we went through stage 1, then through clinical senate, and then stage 2. So that actually took quite a long time. And then that led us then to refine up. So we went through the process of coming up with a long list of loads of different options, narrowed down to 4 preferred options, and then went to public consultation with 1 preferred option that people felt was the most appropriate for Dorset. And you'll see from the survey findings, so last autumn we finished the consultation, and you'll see, and this is basically the benefits of going through a co-production process, really significant support for the proposed model. It's not very often you see in the 90s agreement for a model of care from the Dorset population. So we were really pleased, and the things that people told us that they were slightly concerned about was cognitive stimulation therapy. The preferred model was particularly to do with costs. We were limiting it to those that didn't benefit from anti-dementia medication, but the population told us that actually, great idea, but actually we'd like it opened up for everybody. So we made that change and adjusted the costs. So and other tweaks that we made following the consultation. So this is the sort of new model of care in a sort of diagram, and I know you won't be able to read it very well from the slide, but it is in your packs, and you'll see that it's linked very much to the community. It isn't about a service running in isolation. The idea is that it's very much supporting people to live well with dementia for as long as possible, and it's very much the ambition is to enable people to live in their own homes for as long as possible and to offer more support to family carers, because they are often, you know, they're the bedrock, aren't they, supporting people. But it's linking to all the other elements. So the dementia coordinators is a brand new role. There will be about 32 across Dorset, and also specific ones for people who've got young onset. And they will be linking, they'll be part of the primary care networks, so very much around place-based care. They'll be supporting and linking with multidisciplinary teams and the whole array of other services that are in primary care and in secondary care. And the important bit is the dementia coordinators will be, from the point of diagnosis, that person won't be discharged from the service. It's from diagnosis to end of life. And that, again, is something that people really, really wanted, because most people, once they've had a diagnosis, they actually like a bit of information and support, but then they go on and get on and live their lives until the disease and they start to deteriorate. And when things start to escalate, people want to know who to contact and also to have support in a crisis. So we're also linking to the new crisis helpline that Dorset Healthcare are providing. So it's very, very exciting new model. So this is the key new service elements. So I've mentioned the dementia coordinators. There's changes to the diagnostic service. So basically we'll make it more streamlined, less fragmented, and much quicker for people to receive a diagnosis. We'll be putting in also neuropsychology. So for the cases that need a few more tests, extra, particularly for people who are younger, and we are seeing more people getting a diagnosis who are under 65. So there'll be an improved diagnostic service. Cognitive stimulation therapy basically available for everybody, so that is something that people have wanted, and it will be very important. Putting in the day hospitals, so we're aligning them to the intensive support service, so that's what's called the old intermediate care service for dementia, which provides ongoing support for people for up to 6 weeks in a crisis situation. And what was felt was an important that service particularly prevents people ending up as an inpatient, but what is felt important is that people might need a safe environment in the daytime, to reduce the carer burden, but also when people are in a crisis situation, people do need professional support and clinical support. So the day hospitals were felt as a useful model to enable that. Dementia roadshows, people didn't like that terminology, although they'd actually come up with it in the first place, but I think probably a better way of describing them is dementia information events. So that is from the point when people have had a diagnosis, local event which has a clinician giving a short education talk, and then a range of local services that people can meet, and to take the fear out of dementia. And it will be very localised, and also linking with dementia-friendly communities. There's some great things going on at the moment. And also carer support workshops. So recognising that for carers, once their loved one has had a diagnosis, things will change enormously for them. So this is helping them understand that process, which particularly is actually a grieving process, to help them manage that process of change, provide them on some support and education, but also enable them to meet people in that same situation that they can continue to have support if they choose to. So the benefits, there'll be investment into the local services. So what we're looking at is an investment for a 4-year effect of just over 1.1 million. People would experience a smoother and quicker diagnostic process. We'd expect improved outcomes for people living with dementia and their families. We believe that family carers would have greater support and improved resilience. It's particularly around the post-diagnostic support. It's providing support care close to people's own homes and, importantly, preventing unnecessary hospital admissions. We know that hospitals are the last place people want to go unless they really have to, and people with dementia do deteriorate very rapidly once they're in an inpatient environment. So the services will be more efficient and cost effective, greater compliance with NICE standards, and a whole range of different cost benefits which are detailed in your report. So that's my gallop through Dementia Services Review.
Thanks for that, Diane. Hang on there, I think you're going to have some questions. We'll start with David.
Thank you. Really a comment, and I know it's been said before, I think this is a fantastic piece of work. We're all touched by dementia at some point in our lives, and as a GP, I see a lot of families, and I think the two frustrations are the timeliness to diagnosis and also then the feeling that you're left alone once the diagnosis has been made. And I think this absolutely covers both of those, so I really support it. Thank you very much.
Jan?
Yes, I want to say I think it's a really important development for our local services. Just wanted to acknowledge that in terms of us looking at our social care services, we weren't, because of local government reorganisation, we had intended to try and do this piece of review work together across social care and health and weren't able to. So I think now is the time where we will be looking as BCP Council at how do we look at enhancing our own responses to dementia. I just wanted to mention that in our corporate strategy we have a priority about age-friendly communities, and under that we'll want to work with partners around developing our age-friendly approach, including dementia and including extending the communities that have dementia-friendly initiatives in them. We've got some really good examples, but we want to expand that with partners, so that's a key synergy with our corporate plan. The other thing I just wanted to kind of just think about is that we have had some recent national projections of increased rates of people who will be diagnosed with dementia over the coming years. And I just wanted to kind of note really that the current investment is great, but actually we are all going to have to think about what is the growth in services required to actually meet what is a really advancing demographic over years. And I think we just need to note that an investment today is going to have to be constantly reviewed given the increased projection in numbers.
Yeah, I mean, can I just add to that? There's obviously a concern from my point of view of the way that dementia is treated very differently within the health service and what lobbying can be done as around actually if you've got dementia but you're not physically in a hospital bed, there's a massive burden on the local authority and on the family, which actually has a huge impact on being able to deal with other issues. And yet most people who are involved with it as a family member, and I'm sure David hears this every day of the week, is if my relative had cancer, there would be no question about whether they got a service and who was going to pay for it, and there wouldn't be an argument. It would happen. Whereas if my family member has got Alzheimer's, you know, we have to deal with a lot more personal input, and we have to fight for it, and there's an argument over who's going to pay for it. And actually it's a medical condition, and I'm wondering what lobbying's being done from the CCG and the health end to actually get the government to recognise that actually should all of that burden, or as much of the burden as is currently being laid at the local authorities' feet to deal with that wraparound service, than the health services, because it is a medical condition. I've got Sandra, I've got Debbie, but I don't know whether Sally and Diane want to come back on that first.
It is a medical condition, but the problem is it's the social environment and the social support, which is a crucial part as well. I think when you talk to people living with dementia, what they need is connection with their communities. Loneliness is a really big factor for people, support for the family carers. And a really important thing, I think, which again falls much more on the sort of social care element, is respite for family carers. And I think that is something we do as a whole system need to look at for the future. One of the things, just building on what Jan said earlier, so we have actually now reconvened a dementia joint officers meeting. So now with Dorset Council, BCP and ourselves now, we're actually starting to look how can we do some joint work and what do we need to do as a whole system, because we all have to work together. Yes, I mean, there are national issues, we all know that, and I think the more people can influence in the opportunities, the better, but at this point, we're not there, so I think all we can do is do our best. And the dementia coordinators will offer something new. I mean, we have provided, through the Member Support and Advisory Service, some post-diagnostic support, but that service, has been stretched and under capacity, and there's been lots of different issues. So I think this is a new opportunity for Dorset, and I think it's just great that we've got such public support behind what we've come up with, so together. So.
I forgot about Seth. I'm going to go to Sally and I'm going to go to Seth before I go to other people. So, sorry, Seth.
Thank you, Chair.
Sorry, do you want to can Sally just come back on?
Yes, I'm just going to compliment really what Di said. I think it is a joint responsibility, and that's why we're really keen to continue to work in partnership around this area. But I do think the work that we've done in Dorset is a real demonstration of our local commitment to improve services for people with dementia and their families. We absolutely recognise that we continue to need to model the growth in need around this population, but this is a really good first step in putting some significant investment to support people, and I think we need to recognise and value that. We are anticipating that there will be the sign-off of the commitment for the investment at our governing body in March, so that's the final hurdle, as it were, to actually then be able to mobilise a service next year. But we're absolutely mindful of the need to continue to model the impact of our demographic. We do lobby up the line. Interestingly, dementia isn't part of the bundle of mental health conditions that's considered as part of the parity of esteem investment, which we think is a bit odd, but it isn't. So we've actually needed to look at a different way in which we can support the investment, because it isn't part of that bundle of mental health parity. But you're absolutely right. Dementia, along with other people's mental health conditions, we'll be talking about children and young people shortly. We know we've got a massive disparity gap that we really do need as a system to keep a focus on, and that commitment to address that.
Thanks, Sally. Seth.
Thank you, Chair. So tragically, there have been links with dementia and some of our more recent fatal fires, and that is going to continue. So I'd like to sort of offer the fire service in terms of some prevention activity. We can do that. That'd be really good if we can do some collaboration. Obviously, giving a safe and well visit to someone with dementia has perhaps limited impact, and it'd be really more important for us to link in with the carers, to do some training, to do some awareness.
We've already made time. So what we have in Dorset is a Dorset Dementia Partnership, which we set up back in 2012, and the fire service have been part of that right from the initiation, and I know that they do home visits, particularly around that, because yes, it is a big concern. So yes, that is already in place, and I think the more we can expand it, the better. So thank you.
Thanks, Sandra.
Yeah, thank you. Well, obviously I welcome this paper. It is good news. I've got a couple of queries. You did sort of touch on it just now, but obviously dementia doesn't just affect older people. Well, obviously there is a correlation with age. But there's an increasing number of much younger people being diagnosed, and I'm just querying whether there's going to be sufficient emphasis on supporting younger people too, because obviously they're going to have more, their families are going to have more need. And there's another follow, if I can carry on from that. I have been involved locally in setting up a dementia-friendly support group in the community. It's stalled slightly. I'm looking at David because he knows what I'm talking about. We are hoping to set it all up again. Will there be any support for such action groups in the future?
Okay, so taking the point about young onset, so at the moment we've got around about 220 people who are under 65 across Dorset, Bournemouth and Poole and Christchurch, who have been diagnosed with young onset. We anticipate that will slowly increase, I think, because what we're seeing is a greater awareness. People are, there's less stigma attached to dementia now than there was in previous years, so people are coming forward more. So there are some specific dementia coordinators going to be allocated for young onset. So because it does require quite a different skill set.
Exactly.
Somebody who's 50 would have very different needs from somebody who's, say, 90. Some of them will be still supporting their families. They may be trying to hold down jobs, all sorts of different things. So that's going to be really important. And also what we're seeing, and again, this is through the Dementia Partnership, and the growth of dementia-friendly communities, there's more groups actually starting to just set themselves up, and that's really excellent. Your second question about dementia-friendly communities and groups. I know that BCP are very keen to support dementia-friendly communities, and Zena, who leads on that, we've already had those conversations. Yes. So yes, they're already planning up how they can support dementia-friendly communities much more. We've also had a big piece of work that's gone on into GP surgeries, so the iSpace project to make dementia-friendly GP surgeries. So I think more and more we'll see that growth go on because people are much more keen, willing to help. And the dementia coordinators will be a really useful conduit to link the dementia-friendly communities into the statutory services, so that the whole idea is for, like I said earlier, local services around primary care networks. So the dementia coordinator would know all what the dementia-friendly communities are doing and be able to signpost people to those services.
Yes, that would be useful. Yeah,
and also when people are deteriorating, because they'll have a dementia-friendly dementia coordinator allocated to them, there should be much less issues of how do you access services because they'll already be into the service. So.
Thank you.
Okay. Thank you. Debbie. Sandra, I'll tell you.
So I just really wanted to make the point, going back to this thing about what is the support that people need. And whatever the cause of the problem, actually it's the support that that is our joint partnership work to try and provide greater support in a whole range of ways. I think this is absolutely fabulous to see this. And like everyone, I recognise that there'll be a lot more demand over time with the projections we have. I was just going to make the point, I firmly believe that we should be continuing to lobby nationally for a better join up of health and social care funding in general, because people are people, and when we have problems and challenges, we want to be looked at as whole people and individuals, and our budgetary arrangements don't always facilitate that, do they? So I'm very keen to support any lobbying that says this should be on the national agenda, and we know that nationally governments have tended to duck this. And I'd be really keen to see us keep that pressure up.
Thanks, Debbie. I think we're on the same page there. Louise.
I've got it. Yeah, it's really good to see how local people and care has been involved in this whole process. One of the things I wanted to make a point about was the carer emotional wellbeing workshops. I think these can be really key. And Healthwatch Dorset did some work with older male carers a couple of years ago. So they're the largest growing group of carers. And I was wondering how you will tailor workshops really to suit older male carers who have quite specific requirements, and maybe general workshops wouldn't work for them.
Well, firstly, the reason they've been called workshops is actually for that very reason, because we know if we call anything emotions or anything like that, or even support groups, men won't touch it. So that is actually why we've called them. So straight away we're trying to attract the male population that we know do have a specific need. I think it will be, we've been piloting these, the carer groups for a little while, and they've been going very well. And I think it's going to be down to the local areas as they develop and how they run them, and to adapt accordingly. And yes, totally think that they'll need to meet the needs. And if, you know, they set up bespoke groups for men, because that'll probably be a safer environment for everybody to come together, that would be brilliant. So
I'd be happy to help and put you in touch with some of those old male carers we work with to help design workshops of work.
That'd be lovely. Yeah, thank you.
Thanks. Sam?
Thank you, Chair. Just a very quick one. Following on, I really welcome the focus on carers. Could you, at the time, make sure that you're getting the right support back from organisations like Live Well Dorset, so that the sort of physical health needs of the carers are considered as well? I think we'd be really pleased to kind of support that.
Okay, I think that's everybody. Oh, no, Leslie.
Thank you, Chairman. No, I just really want to chip in and say what a really good report it was. And I've worked with dementia patients for 25 years or so. It's not been a subject that you have been able to talk about. I think you mentioned stigma. And although it's not a nice, cosy subject, but I'm really glad to see it being brought forward because, as I think Debbie said, that, you know, they're people. It's not, you know, a sort of, there's an awful feeling about it, but they're but for the grace of God, you know. And yes, I'm really glad. I think it was a brilliant report. Thank you. Vis-a-vis the carer workshops, you could consider having them in B&Q maybe.
Great idea. But not home-based because they're not around anymore. Any other similar place where men like to gather? Not that we're stereotyping, Sam? Excellent. Thank you, Diana. It's an extremely good report, and I think it's a really good step in the right direction. Thank you very much for bringing that to us. So, brings us to agenda item 9, Special Educational Needs and Disabilities Quarterly Update. Judith, are you presenting that to us?
I
don't have a paper.
My colleagues
so.
Sally and Janet are also here, but I'm presenting a very short update today because as the Health and Wellbeing Board, we sponsored, we'll remember, an LGA peer review, and it's actually happening this week. So there's something about putting a marker down that actions did happen after the last Health and Wellbeing Board, and I've got a very short update on that. But the most important thing that happened was the commissioning of a peer review team. So colleagues from around the country, from right across the multidisciplinary sector, are on site looking at the quality of our education, health and care plans, talking to parents, talking to representatives of our range of agencies that sit around the Health and Wellbeing Board, and we'll get some feedback tomorrow, of which a number of us are invited. It was an open invitation into the Health and Wellbeing Board. And whilst actions did occur after the last board meeting, such as the Transformation and Development Board did meet in its entirety in December, and a lot of effort has been put in to creating a multi-agency SEND strategy and a joint commissioning strategy, which is really important because we know joint commissioning is underdeveloped across our area. We haven't brought them here for sign-off because we want to benefit from the critical friend feedback that we've invited this week, and we've invited that so that we can prioritise the right activities that children, young people, young adults and their parent carers need us to prioritise. So in a very small nutshell, that's the update. I'm hoping that that is an acceptable update in the light of the fact we've got a peer review team on site. And of course, at the next Health and Wellbeing Board, we would like a more substantive item so that for those who can't attend the full feedback tomorrow, we can indeed bring that into a public forum and bring the proposed strategies and priorities and joint commissioning plans so that we can endorse them at the Health and Wellbeing Board and agree when the regular updates will come so that we can start to see impact and that parents, carers, young adults and children can tell us that we're making a difference. It will also be a good opportunity to showcase what is making a difference and an impact so far, because it isn't all critical friend, it's also celebration of what is working. So a very small update, but I think for a legitimate reason, so I look forward to bringing the full report at the next board, Chair.
Thanks, Judith. Did anyone have any comments on that, or are we content that that's literally just it satisfies our need for a quarterly update without having a full update? My apologies, the paper versus the electronic, see? The paper doesn't have agenda item 7, the BCP housing strategy. The electronic does, and I'm trying to work across the two. So my apologies that my copy here doesn't have it. Can we flip back to agenda item 7, which is the BCP housing strategy? which is to outline the approach to develop a BCP housing strategy and provide an opportunity for early input. I think it's at Lorraine and Kerry.
It's on the agenda, but there's no papers.
Ah, well, that'll be why.
There weren't any papers.
Yeah, there's no paper, so it's a verbal update. Thank you. I'll leave you to get on with that.
Housing, just looking at your agenda today, actually, housing cuts across all of those issues. And it is so integral to everything we do. And looking around the table at the range of agencies, there's a detailed conversation to be had with all of you, separately, but also through this board. So if I can just introduce myself, I'm Lorraine Meanings, Director of Housing for BCP Council, and my colleague Kerry Ruff, who's our Housing Enabling Manager. So we've got some slides similar to the presentation that Nick did and sort of invite a conversation about the issues, but also about how we engage with you going forward, because there is a big and complex debate around housing and how that connects with the whole health and wellbeing agenda. Okay, so I think we've probably, if we take about 10 minutes to go through the slides, is that okay? So we'll whiz through it. It'll be a bit of a gallop, whistle-stop tour, but just to really a bit of a taster about the sorts of things that we want to be having conversations with you about. This one's fairly obvious. We are very clear there is a very strong link between housing and health. Poor housing is not great for the health and the well-being of our residents. So for that reason, plus lots of other reasons, we need to get our housing delivery absolutely right for the BCP area. Okay. This is the wheel that Nick presented, so I won't go through that again, but absolutely the housing strategy fits into the corporate priorities of us as a BCP council. So clearly sustainable environment, we need to build sustainable housing, we need to retrofit our existing housing. Dynamic region, that's all about delivering the houses that we need, the extra houses to meet housing demand. Connected communities, clearly housing has a massive role in ensuring that our communities are sustainable and we create housing that generates really productive communities. Brighter futures, about young people, children and young people, absolutely we need to get the housing offer right for that, for families, and also young people trying to live independently. And lastly, fulfilled lives, that says it all. Housing has got a massive role in delivering fulfilled lives for all of our residents. Okay, so just going to go through a couple of real headline slides to give you a flavour of our housing profile across the BCP area. Hopefully some of this won't be news to you, and it's by no means exhaustive either, so I won't go through all of them. Clearly we're in an area of population growth, and that brings real pressures around housing demands. So not enough houses to go around broadly, and as Nick said, from a local plan point of view, we've got about 2,500 homes potentially to build in addition to our existing homes within the BCP area every year. So where do they go? What do they look like? And where do they go? We need to really scale up our current delivery, and it's not just what we might build as a council, it's obviously how our private developers and our health authority and all our public sector agencies, how we collectively make that happen. We know about the affordability issues. The ratio between average earnings and average house prices is something like 1 to 10, 1 to 8, something like that. So there's real affordability issues. And if you're in the private rented sector, that is very, very difficult as well. Private rented sector rents are up there, benefit levels are down there. So there are a lot of people in our large private rented sector across the BCP area struggling from an affordability point of view. We've got, sadly, in line with most other areas across the country, we've got continually high sustained levels of homelessness, and rough sleeping is the most severe form of homelessness. And we've got lots of joint working. We've established a new BCP homelessness partnership, working with our many public sector and voluntary sector partners to try to prevent homelessness and get as far upstream as we can to make sure that people don't end up in that crisis situation. So obviously from a health and wellbeing point of view, that is kind of really what we don't want to be having. We've got council housing, we've got different models across the piece which we need to look at. We've obviously got pockets of deprivation and different types of accommodation within specific areas across BCP. So for example, in some areas we've got quite a lot of houses in multiple occupation, effectively kind of bedsit housing, which brings issues for how that community as a whole functions.
and the health and wellbeing issues that come with all of that. We've got universities, we've got purpose-built student accommodation, we've got students living in family housing, we've got that whole dynamic to kind of work out. We've got lots of empty properties. We're not that dissimilar to most areas, and there is always a churn of properties that remain empty as conveyancing goes through, as properties get sold. But we probably need to do more about that to try to encourage owners. There are a lot of owners that are not to be found anywhere and have vacant properties. So we do a bit of work, and we probably need to do more on that. And the green belt, coming back to Nick Perrin's issues, where do we build all these new homes that we need? Obviously really contentious discussions. Okay, so in terms of where the housing strategy fits in, it is kind of the overarching strategy that hopes to pick up all of the issues that housing cross-cuts. So we will have a homelessness strategy, and Kerry will talk in a minute about how we go about creating that, and obviously interested to hear about how the board feeds into that. Underneath that we will have, and we're working on developing a homelessness strategy. We're working on an allocations policy, which is how we allocate our council properties and our social housing. We'll have a housing development strategy. So really all these feed into an overarching housing strategy. So that's the kind of policy framework. And these are the sorts of issues, none of this will be news to you. These are a selection and a completely non-exhaustive list of the sorts of things that we will be looking at and talking to yourselves and our many partners about. The care leavers agenda, what do we do in terms of making sure those young people have got the housing they need? Obviously the climate and ecological emergency, that is very much at the heart of our thinking at the moment. Slightly worried I was getting a wood burner fitted to my property, so I might have to rethink that one. Yeah, I got the quote and everything, so I might have to rethink that and just put a jumper on or something. So how do we help people coming out of prison to make sure they don't reoffend? Because we know that housing is a really key factor in their success in moving away from offending behaviour. So I won't go through that. So that's it's a really complex area, and it's really, really cross-cutting. So if I can move on to Kerry, who's going to take us through the rest of these slides.
Okay, this isn't the final list. This is just sort of the headline things that we think are some of the priorities, the still remaining priorities across BCP. So housing supply still being up there because of the unmet demand that we've got, which also features in the local plan as well as the housing strategy, and that includes affordable housing. Well-managed homes, between as the whole Bournemouth, Christchurch and Poole now, we've got almost 10,000 homes to maintain. So we've got a bigger housing stock portfolio. We need to make sure that's managed effectively, and we also need to keep up the ante that we have and the influence and the tools that we've got to influence the private sector housing and the conditions. Because as just going back over the slides, going back to the Marmot review, clearly the housing, where you grow, where you live, where you age, and your environment can have a significant impact on your health and well-being. Homelessness and assisting vulnerable people still remains a key priority. We anticipate, and area regeneration. So across Bournemouth, Christchurch and Poole, there are key areas that have been identified for regeneration, some of which has been stalled for some time, really needs to come forward to help with that housing supply. And then, of course, the big challenge of the commitment that BCP has made, and this goes across worldwide really, sustainability and climate change action plans, and where housing fits into that and can help certainly, impact on climate change and certainly look to reduce a carbon footprint. So the challenges. This is just catching some of the aspects of meeting those challenges. So housing supply and affordable housing, where does it go? Well, I know that's a thing that's a bit of a broken record this morning. Where do we put it all? So that is a huge challenge, of understanding what land we have available and is suitable to put housing on. And then the infrastructure that's needed around it. And the sustainability of that development, no log burners that we've learnt this morning. The council's role in housing delivery, how we enable it and how we can work with other partners to deliver it, because we're not going to be able to achieve it all ourselves. And use of our own assets for housing. Viability still remains a huge issue, and as Lorraine's already mentioned about how we intervene on dealing with the empty properties that we've got, so making the most of what's already actually there and built. So more challenges. So starting with our council homes, about how at the moment we've got two different models. Bournemouth has an in-house service that deals with managing its council stock, and in Poole it's sourced out to an arm's length management organisation called Poole Housing Partnership. So buying both models, but there's two different models, so it's kind of how does that work? So that's something that needs to be looked at. What tenancy types we've got, and then the social rent versus affordable rent levels. Social rent, brilliant if we can achieve it, but it costs a lot more to be able to deliver the social rent housing. The scarce housing resources that we've got, probably key for this board, about the specialist housing that we need, drug abuse, care leavers, homelessness, and countless others. You've touched on dementia. We've had a dementia care presentation, so all things that need to be considered. And again, our own stock improvements, so kind of what do we do? How can we effectively make sure that it's safe? Can we retrofit and make sure again that we're looking at that climate change and carbon reduction? And the same with the private rented sector, how we use the licensing and enforcement tools that we've got to improve that private sector. And maybe addressing some of the low-income households, the role of housing in multiple occupancy, that's particularly in Bournemouth is very high, and we just need to understand and get under the skin of that a bit more, and how we can maybe influence that and then make improvements. And ensuring compliance for fire safety, including buildings with dangerous cladding, fuel poverty issues, and how to encourage investment. How can we do that? And again, we might not be able to do it all on our own, so we might need to look at outward investment. How do we do that? And then homelessness and assisting vulnerable people. Again, just dealing with the allocation policy changes, which we'll come on to in a bit, that's going to be coming in, and those local connections. Addressing the homelessness still, and the rough sleeping. And the impact of rough sleeping on the wider community, working collaboratively with voluntary and faith sectors on some of these issues, and dealing with what we do to address things, how that fits with the media communications and the polarised views around how a council should be addressing it, because we know we've tried things in the past and it's not always been popular, it's maybe not always been right. So again, it's a challenge to think about how do we get that right. So, this is just a rough timetable for the BCP housing strategy that we had approval in October last year on the principles for developing the strategy and agreement to consult. It's being developed at the moment with regard to producing a draft issues and options document, which will have an options running alongside of it. And we're hoping to be able to go out to a 12-week public consultation in April. The end of that consultation period should be in July this year, and then we will address the feedback, produce a finalised strategy based on all of the comments, feedback, everything that we've had, to hopefully take the strategy back to council for approval in October. So, Health and Wellbeing Board and how we're going to engage with you. So, as I think it's already been mentioned, I think Lorraine was supposed to be handing back to you on that.
Yeah,
Sorry.
yeah, back to Lorraine. So, yeah, thanks, Kerry. So, sort of parting comments, really, just in light of the discussion we had about the local plan as well. Do we want to, we certainly want to engage with yourselves as a collective and certainly as individuals as well, because it's clearly a very, very complex issue, and we need to get the housing strategy in the direction right. Brand new council, brand new area. So just a proposal really for discussion about whether we follow the same principle as the local plan, to have a workshop style event to unpick perhaps alongside the local plan, because they dovetail quite nicely. To think through all of those issues as a collective, and also to flag up two other consultations which are going along a similar timeline, which are very interrelated and are key elements of the new housing strategy, which is the allocations policy, which is due to go to Cabinet in July. So over the sort of springtime, we'll be doing some in-depth consultation around that, about how we allocate our housing association and council properties. And also we will be developing at a similar timeline the homelessness strategy, which is a very obviously complex deep dive into the world of homelessness. So we could potentially wrap that up all into one workshop in the spring. I would welcome that, but obviously there's lots of different ways of doing that. So I wanted to throw it open to questions really about how we engage with you, and also maybe what the key issues are from your perspectives.
Thank you, Lorraine. Can we have lots of those? Because I think they'd be really popular. Yeah. Not very disabled access friendly though, I suppose, but there we go. So we throw that open to questions and comments. Judith.
So I really thank you. It's really helpful to have that presentation. I really welcome the Health and Wellbeing Board working as a collective. I think that Health and Wellbeing Boards struggle sometimes to co-create and stand by strategies that are then published that affect the people that interact with our respective agencies on a day-by-day basis, and the ability to influence the development of a strategy that is then endorsed by the community's politically elected representatives, I think is a really strong way for a new Health and Wellbeing Board to start. So I would really welcome that. It's a different way of working, but I think it pushes us into owning the place-shaping agenda for the benefit of health outcomes for our communities. So I would really welcome that. I know it's another ask on the diary, but I think that it's a really positive step forward, so I would propose that we adopt that approach.
Thanks, Judith. Kieran?
Yes, so I think this is a really exciting opportunity, the new housing strategy, to think about housing differently. I think it's such a, as was stated in the presentation, such a cross-cutting thing. You know, that's why I'm so passionate about housing, because I think everything starts at home. You know, it really affects our physical health, our mental health, our well-being, everything that this board stands for. So I really appreciate your input going into it in the near future. And I think that it's, just want to reiterate really that it's a really exciting opportunity, that kind of thing. And just kind of an example of this is, like, you look at the agenda, and it can affect everything in the agenda, really, like the dementia services. You have to think about somebody who's suffering from dementia, their house, you know, making it dementia friendly. There's like different techniques, colours, paint that kind of affect. And it's that kind of minutiae detail that we're like looking for, and them ideas that we want to kind of incorporate into the housing strategy. So yeah, really welcome your thoughts going forward.
Thank you, Jan.
I'd really endorse us working together. I think a joint workshop on local plan and housing would be really great. I think we might just want to invite partners to think about whether we broaden the representation from organisations, so partners can think about who they'd want to bring. So I think that's maybe something we need to look at. So a few points. I do wonder whether this is the time in where we do some work across organisations to look at, do we or don't we need key worker housing? And if we need key worker housing, what evidence for the public sector, what evidence is required to put that into policy? So I think that's one thing that we could usefully have a real debate about, because I know from the housing side it's always been difficult to assemble the evidence that makes that work. So I think this is a good opportunity to have that. I would like to just raise, we talked there about using council assets. I think I would like to put on the table, should we not be using partner assets as well for key social benefit for our community? So for social housing, and in my world, we will in parallel be doing an extra care residential and nursing care strategy. So also in terms of what do we need in terms of care sector provision. And so I would really welcome it, but I just think it is about us all owning a contribution to how we deliver that for our communities.
Sam.
Thank you, Chair. Just two very quick comments. Really support the workshop approach, and also I completely agree with Judith's comment about consistent engagement. So some of the issues that have come through in the past around the housing mix and the tenure mix in places like Boscombe, having a Health and Wellbeing Board approach that's consistent with the joint health and wellbeing strategy to make sure that we're not doing policy in one area that has unintended consequences in another, I would really, really welcome. I guess the other quick comment I'd make, not for solving in this board, but we've run a Pan Dorset Healthy Homes programme for a while. I guess our ambition would be to spread and sustain that and grow that, and we'd look forward to kind of discussing the best way to do that, because I realise there are initiatives in BCP Council already underway. Just really sort of putting a marker down that we'd like to kind of discuss a good way forward for that.
Thanks. Just very quickly, Jan, I would just endorse what you've said about the key worker housing and all the issues in the workshop. Sounds great. I'm just very mindful. I mean, there are an awful lot of very complex issues on our agenda, all of which you can really see the links, and it's great that we're all here helping to make those links. I think in these workshops, we're just a bit of a plea in light of the complexity of it all. There are numerous people within our organisations, I would guess, who've got a different lens that they see down and can bring into these discussions. So when we're organising the workshops, if we can try and be thinking about what's the questions that we want to ask at those and get that out in the invites so we can get the right people into those sessions. My nervousness is that I'll end up saying, you know, I've got to send somebody to this, and I might be sending all the wrong people or persons. So as much notice as possible of the dates would be really helpful, and a little bit of an what are the questions that you'd like answered, because I know from my organisation there'll be different types of people I could send that would have really add value, and we want to get that right for you, for us, and for our residents, really.
Yeah, I think that's really helpful if we can give you the heads up on that, to do that thinking beforehand, to sort of come in with a view. And also I think what might be helpful is we let you know what the whole schedule of consultation is going to be over the 12 weeks, because there will be other sort of stakeholder partnership events, and then you can take a view in terms of how you potentially field some of that attendance for your organisation, some of the other events perhaps as well. So we'll endeavour to do that before the workshops.
So I think the plan was that the development session in the spring would deal with this, which brings together this and the local plan. I think we need to possibly consider whether there's a lot of similarity between the two and what we might want to deliver, but there are also some other issues that are independent of each other, and so we'll need to have a think, myself and Tim and Jan, about whether they are the right two things to bring together at the same time, whether we need to break it into two sections so that you might have different people that you want there at different times, and you need to be clear about your ask, and that you're not sat through something, or somebody isn't sat through something for which they have absolutely no interest and feel like they've lost several hours of their day. So I think we need to consider that between both the planning team and Kate's team as well. So perhaps we can give that some thought. Judith, you had something you wanted to add?
The approach that Debbie was putting on the table, and that we retrofit it to the local plan, that we have the curious questions beforehand so that we can bring the right people, and that we maximise the impact of a workshop which should then deliver the strategic influence to these big pieces of work, rather than it being a nice place to have a chat.
Within that, so we really need to make sure we make the best use of everybody's time.
As much as I love a chat, look at my diary, I ain't got time for chats anymore. And I'm sure everybody else is in the same boat. Anybody else want to add to that, or do we just close that by thanking you guys for bringing that along, and we'll work with Kate to figure out the best way of taking that forwards. Okay, and apologies for getting you out of order, Kerry.
The presentation wasn't going to Kate, I think, but
We add the presentation to the minutes. Yeah, that's fine. Bob, could you follow that up so that the presentation can be added into the minutes for the benefit of those that aren't here? Thank you. Thanks, Kerry. Okay, so that takes us back to agenda item 10, which is the the CAMS update.
Yes, thank you, Chair. Elaine's going to join us at the table.
Thank you, Sally.
So, yes, Elaine is our joint officer, actually, between the Council and the CCG that has been working with partners around our really important area around children and young people's mental health and wellbeing. Elaine, you're going to take us through the paper rather than a presentation, aren't you? So I'll pass it over.
Thank you. I was just going to plug myself in, but that's not going to work, is it? Thanks for the invite to talk about children and young people's mental health, and I'm really happy to follow Lorraine, as long as she doesn't forget mental health supported housing, because housing and mental health, they're our future, aren't they? Children as well. So this was to kind of bring an update around children and young people's mental health services based on quite a few developments nationally and locally. It was to give you a chance to take a look at it, ask questions via comments, and for us to take the work forward, hopefully, as a result of some of that. So the long-term, there was a 5-year forward view plan for mental health, and then last year the long-term plan for the NHS was introduced, and within that there was quite a strong focus around children and young people, specifically around 0 to 25 age group, because currently mental health services are 0 to 18. There was a notion around increasing the access to NHS-funded services for any child or young person who might have a mental health condition. And it's important to note that the 2021 kind of NHS target for access is only 35% of the prevalent population. And for the prevalent population across Dorset is around 13,000 children and young people. And we're only funding Dorset Healthcare and the CAM services to see 35% of those. So that's a really disappointing target. The CCG in Dorset had already asked for myself and Stuart Lynch, who's the CAMS service lead, to take a look at how we would start to address the needs of the 65% that are sort of remaining. So they were kind of ahead of the 10-year plan, which is kind of a nice thing. But now there's a particular mandate actually for us to start doing that. We've done some work already. We've introduced quite a lot of different things. The Discovery Project that's going into schools. CAMS has redesigned itself around the Thrive model. So I don't know if you know about Thrive. It's basically it's a virtual model of service delivery that kind of takes out the tiers. Hopefully all round, not just the levels, but the tiers around getting access to CAMS. It takes account of the child's need, i.e. that at any point in a child's sort of emotional development, that they'll have a different set of needs, and at a different set of time, they'll need a different kind of approach in terms of service. So we've already done a lot of work, but we're at that stage where I think structurally we need to change some things in order to continue the transformation. So there are some must-dos. I'm whistle-stopping through this. I hope that's okay, because I'm assuming that you've had a chance to read the paper. So hopefully I'm just pulling out the salient points for you, but I'm really happy to take questions. So currently in our system, we've got 6 core CAMS teams. They're really busy. They're exceptionally busy in Bournemouth and Poole. And if there are any real pressures, it's in the conurbation. So that's an acknowledgement. We've got 2 learning disabilities CAM services. We've got inpatient service that's NHS England commissioned, and that's called Pebble Lodge, and there are some plans around that for the future. We've got an eating disorder service, early intervention, so first onset psychosis, which was for 14 to 35-year-olds, and now I think it's going to be extended for up to 65-year-olds, so anyone with a first onset kind of psychosis. We're developing all-age psychiatric liaison service, so if you happen to need a psychiatric assessment on any of the 3 acutes, you'll be able to access that really quickly, and that includes access to CAMS practitioners. So we've got other bits, CAMS, forensic CAMS. We've got nurses and psychologists in the looked after children service. So there is an emphasis on partnership across the county. So local authorities, public health, education, Parent Carers Association. They're all part of our partnership, and we have a steering group basically that kind of oversees all that and then reports to either the Mental Health Programme Board, yourselves, HOSC, whoever has an interest, happy to report to. So the future, I'd say it was looking quite rosy because NHS England and the government have said that in terms of children and young people's investment, it's got to be higher than all the other bits of investment. And so the focus is on young people, which is really good, and not before time probably, given the 65%, in all honesty. So across Dorset, there are some must-dos, and there are a few local developments that will kind of change things a bit structurally in order for us to provide all the other bits of wraparound service. So if I talk about those, we've got mental health support teams in schools being developed now. We've got the recruitment done. We've got 3 sites. We've got Weymouth, Portland, North Dorset, and a team in BCP. On each site, there's a team. It consists of some senior practitioners, 4 kind of health and wellbeing practitioners. They'll be working into schools. There are about 19 schools on each site, and we've got partnerships being developed. Each team will operate differently because the needs of the area will kind of dictate what the team does. So we've got those happening. That we're part of the pilot. It came out from the Green Paper. I don't know if any of you saw it, around the need for mental health interventions in schools. And interestingly, we're in the middle of view seeking at the minute, and nearly all children and young people that I've spoken to are saying it's when we're in school and there's an inappropriate response to me having a panic attack, or like I'm having now, actually. Sorry, dry mouth, gobbledygook. So it's kind of that they're all saying we don't get an appropriate response from teachers. We don't feel they've got adequate training, knowledge about how to respond to us. So it's all those kind of things. So we're part of the pilot site. We may have a chance to put in a bid for a couple of extras or extensions, and really working it at a bit of a wangle around children who are excluded from schools, because we think actually if we did some prevention work, we could prevent some exclusions. And if you look at the outcomes for children excluded, they're absolutely appalling. They're 20 before they even start to attain some of the things that 15 and 16-year-olds, and it's really, really bad across the county. So that's one of the must-dos. The other must-do is crisis home treatment. So this is NHS England kind of invest to save approach, but basically it'll support children across the county who are in crisis, who may end up in hospital, and those teams, I think we'll have one each side of the county, will be able to visit children and young people up to 3 times a day in order really to keep them out of hospital, and that frees up beds for those who really do need a hospital admission. So these are kind of things. And in other areas, they've either made savings, which they've then reinvested into the system for children and young people. So it's a good scheme, but we're going with it because it's mandated, and it will probably be a really good offer for our children and young people. The final thing that is more locally driven, but we're going forward with, is, I don't really know how to describe it. We've called it a BIT, and this is an acronym for Assessment and Brief Intervention Service. We thought abyss, that's not a good thing, is it, if your referrals are heading into the abyss and they don't get picked up. But we're going to, I think, put the name out for competition somewhere. But it's basically a notion around a single entry point into mental health services in Dorset. We're going to pilot in BCP first, because the Bournemouth and Poole teams are the most pressured, and where there's a longer wait for time. So the notion around it, and other areas where they've tried it, there's been between sort of 43 to 63% reduction in the number of children who are waiting, and then who need to go on to more specialist kind of interventions. So that service or team will be the gateway into children and young people's mental health. There'll be a meet and a greet, so in that kind of way they'll be assessed. They'll be offered brief intervention either in groups or individually over a 4-week period, and hopefully at the end of that 4-week period there'll be a really good formulation about whether that child and young person could be referred back to the schools teams or other bits of programme that we've got going on around sort of resilience building, emotional health, wellbeing, sort of, and those kind of things, and then, or whether that child needs a more kind of intensive bit of service. So they're the things that are progressing. And the other bit of work that's a big piece of work is at the minute we're kind of looking at, we're view seeking, so already out and about. I went to Youth Parliament last week. I wouldn't have gone if I'd have known what it was going to be like, because basically it was loads of switched on young people firing questions and comments at me, and it was brilliant. I absolutely loved it. I would have, well, I wouldn't have gone, I don't think. Anyway, so we've got loads of things going on. So we're view seeking. We're basically asking 3 questions: what's good, what's not, and what would you do differently? We started some of that work visiting groups like the Youth Parliament. There's a survey that's coming out next week, and it's out for 4 weeks. We've got lots and lots of partners involved in it in order to just get a sense of where do you think we should be heading over the next 3 or 4 years. These are kind of outside of the must-dos. And this hopefully addresses some of the questions around the 65% who aren't able to access NHS provision at the minute, or NHS funded provision. Alongside that, we've got a needs analysis. We've drafted it. It's a partnership. Public Health are working on it with us. But basically, it'll give us a really good sense of the particular needs across the county. So we already know, for example, in Bournemouth, domestic violence is a really, really significant issue. We already know that in Poole there are some issues around more children on child protection registers and those kind of things. So we're building up a sense from needs and demand and profile analysis that will help shape things. And then there'll be a business case and a strategy. So just to say on the strategy, we've got a local transformation plan that was written in 2015-16. Every year it's been refreshed because that's a requirement for every local area. We've put a holding statement on it this year because with all the changes, we didn't want to kind of update it and then have to re-update it in a month because we've got loads of work going on. So hopefully by, I guess, end of July, we'll be able to refresh that and say where we're at. And then our sort of mental health strategy for children and young people would tie in with Bournemouth BCPs and with Dorset's around emotional health and wellbeing for young people. So I'll shut up there. Feel free to ping questions, Chair.
Thank you, Elaine, and you can now relax. Yeah, you can grab some water. David wanted to come, and I've got some questions, and Sam. So David, do you want to go first?
Right, thank you. Just a real sort of reflection of what it feels like on the ground at the moment in general practice. We have a lot of children and parents sent to us by the schools with mental health issues. We have, I would say, over 50% of our CAMS referrals bounce back. We're asked to refer some of these parents and children to a website to look at sort of self-management, and the parents look at me with incredulity, sort of thinking, you know, that's going to really solve the problems we've got. To me, access to CAMS is really important. I think the other thing, the link with schools is crucial, and we don't have any link with schools in primary care at the moment. We used to have a little bit, and I feel that your pilot, looking at sort of health workers going into schools, is really important. It's actually not happening in our area, and I'm really keen to sort of take that forward. So that's, I really welcome a lot of your suggestions here. I think the school thing is very, very important, and maybe CAMS just being a bit more accessible. Thank you.
Thank you. So on the schools front, so then they're due to be fully up and running by September. We've had 3 workshops already. Primary care networks have been involved in those because probably out of all the interfacing that's going to happen, it's the schools team and primary care. So absolutely, and really happy to work with any GP. So we've had quite a few in those workshops. The issue related to access, So across Dorset, it's a slightly weird picture. So we haven't really had a increase in referrals. We haven't changed the threshold for CAMS, but what we have got is increased complexity for the children and young people who end up with CAMS. They then spend a lot longer open to workers, which then means there's a wait for people. And the fact is we've not funded CAMS to the level that is needed. And the aim is, through all this work, is to address some of that. So I don't know if Colin wants to come in, because he's here as a representative, but...
Colin, do you want to those next questions?
Yes, I just need to own being an ex-CAMS clinician before I start talking. So where the war wounds well. I think for me, the point I just kind of want to make building on this is around the danger of seeing expansion of CAMS as the solution versus actually how do we expand services and offers across a whole pathway of need, which doesn't just direct every young person into our most highly resourced, highly specialist service. So a lot of the developments that the multi-agency CYP steering group are overseeing are actually more focused on trying to upstream the support as opposed to just continue to kind of build a specialist team that in essence just sort of silts up, because we know that a lot of the need doesn't necessarily kind of require that. And I think the mental health support teams is an incredibly exciting development, and we are quite deliberately trying to keep that, for want of a better way of putting it, as far away from CAMS as possible, so that actually people are recognising that there is a breadth of services out there to support, working much more closely with our kind of local authority colleagues, rather than just one specialist team that, you know, we can pump hundreds of thousands of pounds into it, but it'll never address some of the fundamental challenges around actually what means that our young people have got really challenging mental health needs. Thank you.
Thanks, Colin. Can I come to Sam next?
Thank you, Chair. You partly answered my question, Colin, and I agree with the approach that you've described. I think one of the concerns I had was it's obviously a big gap, isn't it, as described in the paper, when we sort of say 35% of the needs being met by CAMS, but actually what is the appropriate level of service for the number of people that we are aware of that have some level of need? And I hope that we would be able to continue to kind of support the development of that work as the service model evolves. I'm really encouraged by some of the developments, and I agree the work in schools I think is absolutely key. So sort of earlier intervention and earlier appropriate support rather than over-professionalising or perhaps automatically bouncing people up to very, very specialist services, I completely agree with. I just had one question about the assessment and brief intervention service. It's really important that doesn't become another gateway, and I just wondered about who would be providing the sort of brief intervention support in the interim period once you've had an assessment.
So I'm going to frame it slightly different to Elaine insofar as I am going to disagree with her. For me, one of the quality concerns that we know that we have as a local system is our access to CAMS and our waiting times. And from a Dorset healthcare perspective, we are an outstanding organisation, but we are not outstanding when it comes to our children's services. So that is a fundamental recognition. So for me, this initial part is about changing the front door into CAMS to get more throughput, to be able to provide brief interventions and then be able to support people out. We deliberately set it so it's a service transformation at the front door as opposed to a new service being set up, and I think that's a really important distinction. The ambition with it in discussion is that actually, rather than it being a kind of pan-Dorset offer, we're going to pilot it on the BCP footprint with the intention that actually as we move forward, we want to see much more local integration in terms of how that works with other kind of sort of front doors, brokerage services, etc., etc. So it's not a separate service.
So I wonder if I could just clarify on that. Are you suggesting that the 50% of the young people who are bounced back currently by CAMS, or the high number of children who make it through after a horrendous wait for a referral to an initial assessment and are then bounced out, those children and young people will have access to the assessment and brief intervention? Or are you saying we're still going to have those same level of children where GPs are having to give that bad news or parents are having to deal with those traumatised children. Because I'm not quite sure, my initial reading was this is great news, everyone's going to get a little bit in the hope that it doesn't go on, and I'm not quite sure what the answer is.
So it is exactly that. So the intention will be, so we know that we have huge amounts of different referrals coming from different sources with different levels of information. And one of our things that obviously our primary care colleagues are challenged with is every service has a different referral form with a different referral criteria. So the intention of the service and the way it's being set up is that there will be a no wrong referral principle at the front door, whereby people will be able to kind of come in and have a brief welcome conversation with a professional within the team to be able to just talk through exactly what is that support that's being sought. Is specialist CAMS where it needs to be? Are there other brief interventions, brief offers that can be done? So there's a lot of detail, a lot of partnership work gone into actually designing actually how it will work, but the absolute intention is to completely and utterly address the frustration at that front door by being able to go in with some level of low support and then titrate up as needed.
And that's due to start in September, or that's starting more? Because I'm just wondering about how we bring that back to understand what difference experience there is, both from the GP perspective, but actually from the child perspective, as to whether that's successful and how that's going to be assessed as whether it works.
So the aspiration will be that it'll begin to go live as early in the new financial year as possible. Recruitment is our biggest challenge, but we've got a solution with Exeter University that we think will be able to kind of address that. So as soon as we're able to recruit into that without, because obviously what we don't want to then go and do is destabilise another part of our workforce, which is what we often end up doing across health. The service itself will have some very, very clear metrics and outcomes at different levels. So some will be about health utilisation, some will be about experience, some will be actually about clinical improvement, and absolutely more than happy to be able to kind of come back and present on that specific aspect of this wider offer at a later point.
Would you mind if I came in there?
Of course.
So, I've in the course of some of the ViewSeek, and we started with staff across the whole of the CAMS system. Without exception, all of those staff work to their limits, and they're exceptionally frustrated because they're not able to do the practice that they are trained to, because they're managing people on waiting lists. So the single point of access, for want of a better phrase, will really, really enable the practitioners who are in the teams to get cracking with the work that they're committed to providing. So I'd really recommend you at any point going and talking to them, because they're really passionate, skilled people who are under an awful lot of pressure. So I wouldn't, although Dorset Healthcare have got a different perspective because of CQC, without exception I've met some really brilliant people. I'm just saying that because I think it's really fair that they're valued above some of the other stuff. And just to say that a BIP is one part of a system transformation, because the schools teams, I think some of the frustration around having referrals batted back is that some of the early help stuff has been halted over the last few years, which means there's less earlier on. So some of the transformation will address that. So the schools teams will really help. COOF does help some children and young people. We paid for 135 counselling hours per week, and we get like 500 children and young people using counselling through the online service. So it doesn't suit every child, but it does help. We've got chat health. We've got a load of other things that are in place. So one of the things that came up at the governing body at the CCG is around actually everyone knowing where everything is. So we've started to form a bid for some funding around a directory of service that is like TripAdvisor. So not only will it have info, but it'll have a review kind of mechanism. So if you get a crap service, you can put it in. If you get an excellent service, you can put it in. So we're working that kind of thing up. So I think for GPs, for other practitioners who might need to know stuff there, we could make things easier so that so we've got the connection service, which is all age. You can call it 24/7. It's for children and young people. There's a CAMS practitioner. So there's a whole host of things that you may not know of that we could make sure you did know of. Sorry, I'm rattling on.
I think that directory of services would be really useful so that the partners actually know what those options are? Because otherwise you do end up with that thinking it's one option failing, and then... So I think perhaps that could be an action to take away. I think that would be really useful. Debbie, can I come to you next?
Again, just a quick comment. Firstly, to just reiterate and emphasise a couple of things. Firstly, the reality of the pressures, which I think anyone connecting with children and their families will recognise. We feel that, and it's great news that there is this focus. It's great news there's more investment. I suspect we're going to find it's not going to be able to do everything we want it to do, but very important that there's some positive news around not only the model but also the priority that's being given in funding terms. I would be failing in my duty if I didn't say as well that from a hospital perspective, we are really troubled by the number of patients who stay in our hospital beds because there's no support for them outside, or limited support for those with really particular needs. And that's something, again, that these services will help an awful lot in preventing those admissions in the first place, but also supporting people to get out. And I'm talking about the general acute wards, really not good places to be keeping children with very complex needs. The other wider point I just wanted to make was just to remind ourselves as the Health and Wellbeing Board, and our emphasis on prevention in its totality, how everything that we do impacts on all this agenda. So the discussions we've had about neighbourhoods and housing, all these things that impact on mental health. I remember when I was first began getting more involved in commissioning rather than the provision of healthcare, being quite shocked at where do you start in trying to get the very best possible start of life, and it's obviously even preconception. So all the support for new mums, new babies, families, supporting families and neighbourhoods to build resilience, to encourage all those things. It all sounds a bit motherhood and apple pie, but fundamentally, if we're doing those things, it makes a massive difference in terms of the mental health of our population, including our children and young people.
Debbie, Judith.
Thank you. I'm going to take the lead that Debbie's just started and then go back to my point. So I think it's a really important point that you've just raised, and BCP Council has taken decisions and continues to take decisions to prioritise early intervention, and certainly that the corporate plan articulates that, and I think that's a real strength of the local political leadership, which absolutely goes to the heart of starting very early. So as a sort of corporate director for Children's Services, that is a gift for us all. I do want to go back to basics. The voice of young people. It's great that you went to Youth Parliament. I've spoken to some of those young people, as well as some of our care experience young people and other young people in schools and head teachers, and their voice would be that we haven't got it right. This is a step in the right direction. Key, and we purposefully invited this agenda, which is a joint commissioned arrangement, to the Health and Wellbeing Board to bring it into a more jointly owned space, more jointly championed space, and also more visibly accountable, so that we can understand what the experience of a young person who is having some emotional vulnerabilities and mental health vulnerabilities, what it is like and how quickly can they gain access to support at every different point. So I think this is a really good start, and Elaine, you've started us off well, thank you very much. What good looks like for me is that we agree as a Health and Wellbeing Board, what does transparent accountability look like, and how do we really understand volume, demand and the pathways, and not fall into the trapdoor that other governance arrangements have around the country, whereby we understand what the waiting list is like at the front door and we don't stay connected to how long do you wait to the intervention, and then what's the outcome at the intervention, and are you then enabled to be resilient and making full use of the life chances by living in this local area. So really keen to see a really strong balanced scorecard, possibly, not that we spend hours poring all over it, but I'm keen for our Health and Wellbeing Board to stay really connected to what life is like for our vulnerable young people. I do think it's a jointly owned pathway. I think that it's great for a new council to engage in that in a different way, in partnership. It feels a very fractured system, and I think our vulnerable young people are held in some of those fractured points. I think that's an okay and transparently accountable thing to say, and it's a good start point for what we do next. The pilot in one of our schools in BCP is just that. It's a pilot. I think we should be lobbying for more. It's quite a limited pilot nationally. We've done very well across the patch of the CCG to have 3 pilots, but it's not enough. And I think you're right, Elaine, to say we need to stretch that across to young people who are excluded because we're out of pattern nationally. That gives us a window in to the cultural context with it, which isn't necessarily across a whole community of children building and promoting resilience. We've got too many children excluded. So there's something about how in this transformation plan are we collectively going to build confidence in the wider workforce, those people who interact with children on a daily basis, so they don't need to go into specialist pathways. So I'm curious about the workforce element, and of course we'll be committed to support that as we go forward. So really well done for bringing it here. It's a real good starting place, but I really support the Health and Wellbeing Board keeping this agenda for children as a priority and a visible priority through the next year.
Thanks, Judith. Sandra?
Yes, thank you, Chair. Yeah, well, I welcome this paper as well. I do think it's a good start, especially with the mental health teams in schools. In terms of the consultation, I think it would be really helpful if this paper also went to the Children's ONS committee. There are young people on that committee, but they're probably not as frightening as the ones that are going for the MYPs. They're very nice kids. But I think the committee would welcome a look at this paper. Can I just ask a question on the crisis home treatment teams? And I do welcome this as an alternative to hospital admission. I'm just a bit concerned because I think there needs to be sufficient support for the families of the child or the young person that's got the problem, particularly in relation to siblings, because I know that the sibling witnesses this problems and difficulties, and often goes on to have difficulties of their own. So I think if at the time there could be a lot more support goes in, it will probably do a bit of prevention work there. Okay, thanks.
Thank you. Kieran?
Oh, well, I was just about to shoot off, actually.
Well, you've spoken, young man.
Yeah, it was just picking up something from within the presentation. You mentioned about how children weren't getting adequate responses from teachers when they're having panic attacks and things. And I think Jude has kind of already picked up on a bit of it. But is there kind of a wider education piece for people who are interacting with children on a more regular basis?
So yes, the schools teams, there's actually 19 in Bournemouth that BCP that are a part of the pilot, so not just one school. The offer for each pilot site will be different. So for example, in Weymouth and Portland, the schools and the primary care people and the school pastoral team, they all said that what we really need across all the schools participating is for like an induction around mental health. And so that might be a focus for that school team to develop that with the 19 schools. So across the BCP area, as we start, we've already met them in one workshop. There's another planned to be planned for the end of March. That will start to have taken shape because the staff that are running it have the strategic sort of lead for it. They'll be working with each school. They'll be bringing the themes out that come from each school. And so if there is a real significant training need across those schools that are participating for, you know, how to respond when someone's having a panic attack, or how to respond when a behaviour is related to something that is going on at home, and how you manage those kind of difficulties. So I think each site will really develop in its own way. It's really exciting from that point of view because we'll learn a lot. And we've also got schools and primary care networks that aren't involved directly with the pilot, but are involved in the conversations around it. So we'll learn from both kind of either pilot site or non-pilot site, but there'll be a lot of learning. Hope that answers your question.
Jan?
I just want to make a very quick point. We had the first meeting of the Bournemouth, Christchurch and Poole Domestic Violence Strategic Group. I was really interested, Elaine, in joining up needs assessments. So your comment around the impact of domestic abuse in terms of what that does in terms of mental health, we also need to pick up in the strategic work as we're looking at what our domestic abuse strategy is for BCP.
Karen?
Just really quickly, my organisation is commissioned by the council to do some work with young people around volunteering. We do a lot of work with vulnerable young people to get them into volunteering, and we also support voluntary sector projects that promote and support young people to become volunteers and get involved in their community. So I would echo what Colin was saying about, you know, stepping it back a bit, and about if we could get young people more involved at that stage. I think, you know, it's only a small amount that we're doing at the moment, but I think there's potential there to do a lot more work around getting people with younger people with a lower level mental health issues. You know, we've been able to get, for instance, a young man out of his house who hadn't basically left the house, hadn't left the house basically. He's now involved in a gardening project in Boscombe, thinking about going back to college. So that's just one success story. We could multiply that.
Thanks, Karen. Can I just ask a question that's not in the CAMS update, and that is the challenge that we've had, and I know we've brought it up with the Children's Board previously, around the residential medical care for children. Obviously, we've got Pebble Lodge, but there's always been a criticism about the children that are being sent a long way from home, and whether there are any additional developments around those children with very complex, specific and quite unusual conditions, and what are we doing to reduce the impact on them and their families around their mental health care?
So there's within NHS England there's something called New Care Models, which is around trying to work as network services to try and bring people who end up in specialist placements, specialist hospitals, miles and miles and miles away from home back into the local region. So we're within the Wessex footprint. And so all the kind of commissioning is changing with NHS England so that we're looking at being able to provide more beds in county. We're obviously looking at trying to develop a PQ in county, because we know that for us, one area where we are really vulnerable is that actually if we've got a young person who needs a psychiatric intensive care bed, the nearest one is well over 100 miles away from us. And so at that massive point of vulnerability, we're then going to enforce at times them to then go over 100 miles away from their families and their social support networks, which is just, we wouldn't accept it in any other aspect of our health system. So there's a lot of work being done to look at developing parts of those, the earlier conversations about the crisis services around actually can we support more people at home rather than coming into hospital? Can we put a bigger bed base actually within the local area as well, and put more intensive support around it? So it's a real national focus to bring people much, much closer to home rather than having a very disparate specialist offer across the county. And at times, going back to Debbie's point, where we can't find a bed nationally for a young person, and so they end up sitting in pool under specialing until we can find something, which is, you know, completely unacceptable.
There is also another issue when you, and I speak from personal experience, where you have a young person sitting in an acute bed where they don't need a mental health bed, but they do need a mental health conversation, and where they're left in a bed for 5 days because nobody from mental health can come for 5 days, when they don't need a bed, but they do need an intervention to enable an out, you know. And that's a crazy situation, because it's like you need to get these people out of Debbie's beds.
So just to come back on that one point. There was a broader mental health investment programme for next year, which has all been signed off. And one of the key priorities within that programme is that there will be 24/7 liaison psychiatry services at all 3 acute hospitals for children and young people. So there will be a professional on site at all 3 hospitals to be able to do exactly that. So those issues are completely being picked up.
Louise, and then we'll. I've got a proposal I want to bring. I'm conscious of time. We've still got a couple more items.
Thank you. I think the view seeking is really important. It's just really important that local people, their families, young children have a say in all of this, because it's their experience that will develop services that will work, really. Health Watch Dorset, children and young people's mental health is going to be one of our priorities for the year, and we're keen to go out and kind of gather feedback from perhaps young people who haven't had the strongest voice in the past. So we'll be doing some more work on this, and I've been talking to Elaine about that. But you said the survey's coming out next week, and I was just wondering how we as a board could help to promote that, you know, make sure that you get as much feedback as possible, really.
So there's a link that we could have sent to you, and then they can be disseminated, and you can send it to whoever you like. The more the better, really.
It would be good.
Mm.
Yeah.
And the partnership approach that we've taken around the view seeking has been really good. So thanks for your support with that. It's been good. Cheers.
So if we could have that link to go into the minutes, then that would be useful. And just then a formal proposal to actually ask for the ABIT update to come back after 6 months, so that we can just get an idea of where we're going. Can I have a seconder for that proposal, Judith? If that's okay, if we can diarise that to come back 6 months from now. Well, yeah, I mean, the sort of update on how it's going, but very specifically a sort of a direct update on what the outputs from that project are, as well as a general update on the CAMs, and of course to go to the Children's Overview and Scrutiny Board with the update that we've had today for their benefit. That would be useful. Thank you, Elaine. Well done. Move on to agenda item 11, which is the outcome of the Health and Wellbeing Board Development Session from November. This is really just to sort of put in writing the output from that, because obviously that was not a public event, to approve the fact that we're going to adopt a health and wellbeing strategy, which will be considered in June, and to include the decisions that we recorded around prioritising those areas of deprivation, our annual subject, if you like, and then the concentration on areas like SEND within that. Jan, you were going to say a few words on this.
Just a very few words. As you say, this is just about approving what we agreed last time. Just wanted to just update in terms of the areas of deprivation. So our Chief Executive is not here because he's at a meeting, or an initial meeting, to develop the partnership arrangements around Boscombe. So we'll be in a position after that to engage all partners in terms of that. And Kate Ryan has had to leave the meeting, but just wanted me to confirm that she will be convening the Task and Finish group, looking at, we made a commitment about 2 areas of deprivation, but we also committed to have a working group to look at how do we look wider at deprivation across BCP, and how we're going to commit to work together. So Kate just asked me to say she will be convening that meeting.
Okay, so if everyone's... Oh, Louise.
I don't know whether it's the right point to interrupt, but I have to leave in a minute, so I thought I'd better get it in while I go home. So we talked about physical activity being a kind of focus of the board, and tomorrow at the Bridge, where Healthwatch Dorset are based, there's a Dorset Mind fitness and wellbeing session. So lots of different local organisations, kind of taster sessions for fitness classes. And so if anyone's free, please pop down from 12 till 2 tomorrow at the Bridge, which is in the car park of the Little Down Leisure Centre. Thank you very much.
I haven't rehearsed this with Sam, so I'm a bit nervous about saying this, but I did wonder... I just wondered in terms of developing some ideas about how we actually do our year of active engagement. I don't know whether Sam and some of your colleagues might for our next formal board be prepared to just do a bit of a presentation on how we might think about how we're going to engage across the partnership on promoting active lives. Would that feel, because otherwise I think we need a way into that. But I hadn't rehearsed that with Sam, so I apologise.
No, that's fine. So I'll respond very quickly off the cuff. I'm sure that'll be fine. I would just ask whether it would be appropriate to bring in Active Dorset as the major partner that we work with on the Pan Dorset physical activity work. So they're doing work in the Dorset Council area, but their strategy is very much across both councils. So I'm sure that would be. I'm looking at Rachel. She's nodding. That'd be great. Thank you.
Okay, that's fine. Okay, so everyone happy with those recommendations? We go forward, yep, okay. Takes us on to agenda item 12, which is just a very short item, which is around the sign-off for the Our Dorset Looking Forward plan. there have been some robust conversations around some small amendments that were made to make sure that the Our Dorset Looking Forward plan was really covering everything that both our health colleagues and the council colleagues wanted to have in there. And the sign-off of that plan was delegated to myself and Tim. We had a number of conversations around getting the wording right in that report, and that has now gone off to government, I think. It's gone off to NHS England, but that's government, same thing, isn't it? It's gone off to NHS England officially for them to assess it and take the next step. So it's now out of our hands. It has been signed off, but we wanted to make sure that it was on the agenda, that we've acknowledged that that was the arranged process, and that has now been followed for the record. So, okay, the forward plan. We have a copy of the forward plan. It's on the back. Sorry, got it. I got it. So the forward plan, we have the development session. The development session 27th February 2020, not 2019. That's what put me off. So we'll get that amended. And that's going to be around the changes in the health service and an update on the primary care networks. So that will... Judith?
Chair, could we add the LGA peer review around SEND into February?
Does that make more sense?
We can add an hour to it. I think otherwise it will be quite
yeah.
tight.
I'm wondering whether...
I would really propose that the headlines come, because otherwise it won't come until...
yeah, sorry. This is the development session.
Board.
Sorry, this is the private development session.
That's fine. From an accountability point of view, it needs to come to the next formal board. Stand correct.
So for the development session, we'll stick to the proposal around the key changes in health service and primary network updates, and then if we add to the next formal board, the priority being bringing that SEND review, as it has a quarterly review anyway, doesn't it? And we aren't able to get a full update today. We've then obviously got the suicide prevention strategy, Better Care Fund. We have a SEND quarterly update on there. So is there anything else that needs to be added
for the next meeting?
For the next meeting, active physical activity, and for the following development session after that will be the one around the local plan and the housing strategy. So if everyone's content, is there anything else that people feel they want to add to the next couple of meetings? No, otherwise we'll take what we've got already. Fantastic. And that takes on to the final item, which is the dates of next meetings. We've had emails go out around dates beyond June 2020. I don't know whether it's possible for people to respond back with those dates. I know, Debbie, you had an issue with Wednesdays because it's board meeting day.
Fourth Wednesday of the month is a problem.
So I wonder whether we can just get Democratic Services to
I did have a conversation with Karen about the forward dates and trying to avoid your clash.
I'm certainly, I've got the dates in my diary. There will always be times when occasionally one can't make it, but they're in my diary.
Yep.
I haven't seen them clashing with anything dreadful yet.
No, I think proposed dates came out. I don't believe anyone's come back and said that they're a complete disaster. So I think unless we hear to the contrary, those dates that were emailed out will take as read, and we'll make sure that they're published for the next meeting. Yes, if you're unable to attend, it would be really useful to have a senior substitute in order that we can make sure that we've got full representation and that they've got your say-so in what they say in the room.
And Chairman, if I may, the important thing about that is to notify us in advance before the meeting, so for sake of quorum and so on, that you're sending a named person as your substitute.
Thank you. Okay, we don't have any other business that's been tabled, so if everyone's content, at 12:16 I will close the meeting. Thank you very much for your patience.